guys, welcome to my YouTube. Today I'm getting Botox. Yes, so these are my doctors, Dr. Payman Danielpour and Dr. John Lakey. And they're the doctors that do my boobs. So if you want to read all about that, then make sure you check the link below and I'll have it pointing to my boob job blog on my blog. Anyway, so I wanted to ask you guys a couple of questions.
Sure.
Why is Botox a preventative measure for someone as young as I am?
Basically what causes wrinkles is forceful muscle contraction. So when we raise our brows or smile, basically these wrinkles form.
Right.
The more we do the repetitive motion causes those wrinkles to be there forever.
So whenever I'm like giving people a bitchy face?
Absolutely.
Yeah.
And then what Botox does is just makes that muscle not contract as strongly, so therefore those wrinkles don't appear and then they don't become permanent.
What about girls who are concerned about not being able to move their face?
Well, I think that's when too much Botox is given. So if it's done properly, the whole idea for Botox is to reduce the appearance of lines and wrinkles when you're in repose, meaning when you're not making an expression. It's normal to have certain lines when you are smiling or when you are raising your eyebrow. It's just you don't want those lines to remain there after you're done.
Exactly. So if I'm squinting all day and then I go inside and it's not bright out, I don't still have this crease going in there.
Absolutely.
What's pretty standard for someone like me? How often should I be coming in?
You know, the package insert will tell you anywhere between 3 and 4 months, but everyone metabolizes Botox a little differently.
Okay.
We have patients that come twice a year, we have patients that come 4 times a year, but it's never more than 4 times a year because it does work for 3 months at a time.
Is it important to like kind of take breaks and make sure that your muscles can go back to the way that they were moving before?
No, you know, I think if given properly, even for those people who have too much Botox and the forehead is completely frozen, there's nothing wrong with making the muscle atrophy in that portion of the face. Anywhere else might be a little different.
What about Botox for other things like, you know, in your armpits to make you not sweat as much and like migraines? Do you guys see patients for that as well?
Absolutely. It works great for the hands, sweaty palms.
Oh, I didn't even know that.
Sweaty armpits, migraines. For, you know, it's been used for many different things now. But yeah, we do it in our office, and some of those things are actually covered by insurance, so it makes it a lot easier for patients not have to pay out of pocket for them.
That's great. I heard they're also doing a study right now that could prove that Botox in the scalp prevents hair loss in men. Have you heard about that?
Yes.
Have you tried
Currently working on studies for that. I think one of the original users of Botox was giving Botox to his mother, who underwent chemotherapy and lost her hair, noticed that you know, there are certain areas that were regrowing hair.
Wow.
And so you know, further studies are being done. There's no clinical evidence yet, but it's coming soon.
That's interesting. So what do you think is too early? How early should girls kind of start getting it?
You know, it's interesting. Everyone's a little different. So if you look at all your friends and you see them make expressions, some can raise their eyebrows or frown and you barely see anything, and they're 21. Some do it and it really is noticeable. So it's an individualized basis is when you start. We normally think that in your mid-20s, probably good to start doing your preventative measures, meaning getting some facials, using the right type of skin products, and also getting a little bit of Botox. The key is to who's putting it in, where they're doing it. Always go to somebody who's board certified, that knows what they're doing. That's not just, you know, nowadays anyone's doing it. Dentists are doing it, podiatrists are doing it. I think you should go to someone that knows what they're doing, know the facial musculature, so you're not going to look different, and also you're going to still look your age and have some expression.
You don't want to look different, but what about, I've heard that you can get like a shot here and here, just make your eyebrows raised up a little bit. Are those little tricks that you can do to kind of tweak it?
Sure, you can gently raise the arch of the eyebrow, and I say gently.
Right.
I think, again, when it's administered improperly, that's when you get that Spock look.
Right.
You know, you can gently raise the arch of the brows in females just by actually applying it to the center of the forehead and a tiny little bit up top. You have to imagine, everywhere you inject Botox, it relaxes muscles. So if you inject it directly here, it will drop the brow. So it does it. It's counterintuitive. It does exactly the opposite.
I see.
Of what you think.
What about? Okay, so this is a question I'm literally just thinking of now. I feel like I have a crooked smile. This like side of my face is stronger than the other, maybe. Like, I don't know. Would it be, is Botox for something like that, to relax like this side?
Absolutely, it can. It can help if put into the right muscles, you know, because we have elevators and depressors of the lip, of the eyes, of the nose, in our face. And if you know where those muscles are, you can really kind of play with them. But again, there's a fine line as to doing it properly or putting it so you literally can't use a straw or keep water in your mouth and it'll start pouring out of your mouth. So it has to be done properly.
Yeah, so don't get this done in Mexico, you guys, I'm telling you.
And they're all off-label. These are things, you know, Botox is really on-label for only, you know, your what are they called? Frown lines. And now they've actually made it for your crow's feet as well. So.
And what about Botox as opposed to the other, I don't know what the other ones are out there? Which one's your guys' favorite? What do you guys use?
You know, there's Dysport, there's Xeamine. They're all products that are essentially similar to Botox. And each one probably has a role for certain individuals.
Okay.
You know, my preference is Botox has the longest track record, the most amount of data that's out there. And for us, I think, at least in my hands, I think it tends to work the best and last the longest.
Yeah. The only difference is with Botox, sometimes it takes up to a week to work. So it's something that you have to keep in mind.
Right.
So some people that come in here, and we have people that come in for events, the Academy Awards are coming up, things are coming up, they want to look good right before. Well, if they don't come in a week before, then we can use a different product, which is Xeamine, which works faster, but at the same time doesn't work as long. So I like using it for touch-ups or for people that are going to a party the next day or the day after, and it works really fast and people get good results. Just as good as Botox, just doesn't last as long.
Okay. So what about for someone like me who's in their 20s and they're just kind of starting as a preventative measure? What are the areas that you recommend getting?
You know, I think there are three main areas that Botox are used in most practices. And so the first area is directly in the center of the forehead for those frown lines. The second is along the upper aspect of the forehead, so we can get rid of those lines. And then the last is the development of crow's feet. Obviously you don't have that, but again, this is preventative, and so tiny amounts can go a long way.
Right. I always said I had a butt crack in the middle of, you don't want a butt crack right there.
You know, there's actually been a study that was done that shows that Botox can actually help with depression and also other people's how they
perception
feel.
Of you. See, I was thinking I didn't want to get Botox before I did House of DVF because I was like, well, people maybe not be able to tell, you know, if I'm not moving my face or whatever. But then I was like, maybe if I had, I wouldn't have been labeled the bitch of the group the entire freaking time because I wouldn't have been scowling all the time.
It's very true. We have teachers that come in all the time that say that their kids receive them differently because they don't have that scowl, like you said, because the Botox is taken away. They're really nice, but when they want to make that look, they look super mean.
That's how I look when I'm watching TV. Like when I'm working on my blog post, when I'm Instagramming, I'm constantly scowling, and people are like, "Are you okay?" Sorry, it's just something I got from my dad. But anyway. How do you guys numb me up?
So we're going to use that ice.
Okay.
And we'll just keep it there for a second.
Very quick.
Again, in our practice, we like to go very little, you know that.
Yes.
We don't like to put a whole lot of anything in. If you need a little bit more next week, we can always give you more, but I can't take it away. So, a little bit of alcohol just to clean the area. I'll do this.
I forgot to ask you, who shouldn't be getting Botox?
Anybody who's got a neuromuscular disease.
Okay.
You know, myasthenia gravis or multiple sclerosis, people like that. But,
okay.
You know, go ahead and put your head all the way back. I want you to relax. Hold this in your hand. So first thing we're going to do is we're going to give you a couple of Botox injections for your frown lines. Normally there's two muscles there that we target.
Okay.
Go ahead and frown for me. See how these muscles are coming in together? We want to relax those.
Right.
So first thing we're going to do is give you a tiny little injection right here. That gets what's called the procerus muscle. And normally 4 units there. And these are going for the corrugator muscles. And 4 units there. And 4 units there. It's generally not very painful. You tell me.
It's alright. I didn't numb it as long as I normally do.
Numb it some more. So that's basically what I give for the frown lines. Sometimes if they're really wide, the muscles, I'll give a little bit more.
Okay.
But we'll just double check with yours. Maybe we have to give you a tiny bit more.
Right. I know the first time I came in, it, like, in my forehead somewhere when I would move, it started to bulge a
You had a
tiny
little
bit.
bit more,
Yeah.
We'll fix
And
that.
so, I mean, I came back in and you guys took care of it right away.
That's
But
the easiest and best way to do it.
I think that that's just something for people to know, is that, like, you can always come in and you guys will always take care of it. No big deal.
As long as there's not too much given, you can always give a little bit more and even things out.
Right.
Okay? Now take that off and frown for me again. Perfect. And relax. Get just a tiny little bit more on the outside here. 1, 2, and 3.
Oh,
You're doing great. One last
it's not
one.
as bad as bikini wax.
2, 3. And that's it. Now, go ahead and put the ice on your forehead, and we're going to give you some for your forehead now. How do you feel?
It's okay.
So a couple things. After you get Botox, 4 hours of no laying down,
Mm-hmm.
no working out, no
Okay.
yoga, and no bending over. So
No being
you don't want
inverted.
to absolutely.
Keep your head above your heart.
Absolutely, and that's only because we don't want the Botox to move. We want it to stay in one place. Okay, so where I put it, I want it to accurately stay in that area the whole time.
Right.
Okay. Like this.
Brain freeze.
Perfect. Now raise your brows for me. Perfect. And she's got some wrinkles, not a whole lot, so we're just going to just easily just give her a tiny bit here. Tiny bit. Perfect. Whew. What I'm going to do is just give you a tiny bit more, because you like to have that raised, little bit of a raised eyebrow, which I'll do for you. This is going to be very, very little. Go ahead and put the ice back on your forehead for me. Okay, now, we're going to give you a tiny little bit more. This is just for your eyebrows. Put your head all the way back.
Do you see these bumps?
Now, all these bumps do go away by the time you're out of the office.
Okay.
Just a tiny little bit more on the outside, just so you don't look.
That one's not
Turn
as
your head
bad.
to me. Perfect. Nice. Okay, now we'll put a little bit of the corner of the eyebrow. It's called the tail of the eyebrow. This is what raises the eyebrow a little bit.
Oh.
That's the magic right there.
See, I never had it there before. This is the first.
And you'll see, this will really give you that look that you're looking for now. Raise up one last time. Perfect. That's why I give you tiny little bits here. And I like to just go and make sure that there's symmetry the whole way through, and you're not going to have to come back for anything. And that's it. We're all done. Whew. As you can see, there are a couple little bumps on her forehead, but nothing actively bleeding. We put the
Will I
ice.
bruise?
Nope. Put the ice back on. Keep it right there. I normally like people to keep the ice on for a couple minutes,
Okay.
and that's it.
And how many units did I get?
I gave you 28 units.
Is that
You
a
know,
lot?
no, it's not a lot. Normally, the recommended dose for the glabellar lines or the frown lines is 20 units.
Okay.
I gave you 16, okay, and I gave you 12 in the forehead, so it came out to 28. Normally, they give 20 here and about 12 in the forehead. And I didn't give any in your eyes because you don't need it.
So, what is like one mistake that people think about Botox that's just not true? Like one
They think it's
misconception.
poison. They think it is. It's Clostridium. You know, it's a toxin, and what it does is if given at very large doses, it causes muscle paralysis. And what you worry about is diaphragm, so you stop breathing. But it's not something that we have, and it's not. And the Botox that we use is a purified protein. Means all of the active ingredients that are the Clostridium toxin are not in it, so nothing can happen. And the other thing they think is it will when you stop doing it, then you're going to look different. No, once you stop doing it, it's done. I mean, it's basically, it works for the time it's there. Once you stop doing it, it's gone.
And what about women who are like much older and then they think that they'll just get Botox and all the wrinkles will go away?
Yeah.
It's not that, right?
No. Once the wrinkles have formed and they're there, it's very hard to get rid of them with Botox. You want
have to use a
use
filler.
Botox, absolutely. You want to use Botox before they form, so you don't have to. It's all preventative.
Right. And I feel like once you use fillers, then you start using too many fillers.
Exactly.
If you can prevent ever having to use fillers, like that's my goal right now. So that's why I get Botox.
I don't think you're going to have to ever use anything.
Yay. See, and this is a doctor saying this,
There you
so.
go. An honest one.
Yes. Thank you so much for watching. Check out all the links below to my amazing doctors and how you can come in and see them. Thanks.
Thank
Bye.
you. Bye.